What are the occipital nerves, and how do they cause headaches? Imagine a network of tiny roads running from your neck up to your scalp, carrying signals that tell your brain what your skin and muscles feel. These roads are your occipital nerves. They start from the second and third cervical spinal nerves, which are nerves in your neck. The biggest among them is called the greater occipital nerve. It begins from the medial branch of the dorsal ramus of the second cervical nerve. These nerves are responsible for sensing the back of your head, the top of your scalp, and even areas around your ears and above your jawbone. They also supply some muscles at the back of your neck. The greater occipital nerve travels upward between the first and second bones in your neck, called cervical vertebrae. It passes through or beneath muscles like the semispinalis capitis and sometimes the trapezius. Because it runs so close to these muscles, it can get squeezed, irritated, or trapped. This can happen if you strain your neck, hold poor posture, or develop muscle tightness. When the nerve gets compressed or inflamed, it sends pain signals to your brain. This pain often shows up as a headache at the back of your head. When the occipital nerves are irritated, it can cause a condition called occipital neuralgia. This results in sharp, shooting, or throbbing pain that starts at the base of your skull and radiates upward over your scalp. You might also feel tenderness in your scalp, sensitivity to light, or discomfort when you turn your neck. Because these nerves carry sensory information from your scalp and neck muscles, their dysfunction can mimic or add to other headache types like migraines or tension headaches. Understanding how these nerves work is helpful because they can be a source of secondary headaches. These are headaches caused not by the usual migraine mechanisms but by nerve irritation. Treatments like nerve blocks or physical therapy to relax tight muscles can help reduce the pain. Recognizing occipital nerve involvement also helps doctors make accurate diagnoses and choose effective treatments. In short, the occipital nerves are key players in sensing the back of your head and neck. When they become irritated or compressed, they can cause headaches that feel like pain at the base of your skull and scalp. This can lead to conditions like occipital neuralgia and influence other headache disorders. Knowing this connection can help you and your healthcare provider find better ways to manage and treat these types of headaches.